Once again, a warm welcome to everyone, all our Commonwealth scholars and alumni, as well as the QACS scholars and alumni joining the CSE Development in Action webinar series. This is the third webinar of 2024, and today's webinar will be on utilizing research evidence to promote change in remote communities in Bangladesh. This webinar will address the CSE theme of strengthening resilience and response to crisis. Joining us today, we have Zinat Afroze. She is a Commonwealth alumnus. Zinat completed her MSc in Environment and Development at University of Reading, and she is a 2017 Commonwealth Shared Scholar from Bangladesh. A brief introduction about Zinat before I hand over the floor to her. Zinat currently works as the Senior Team Leader for Knowledge Management, Research and Learning for CARE Bangladesh. And in this presentation, in her webinar today, she will be talking about her work on the flagship project for CARE Bangladesh. And she will explain more about this work during her webinar. Prior to this, she worked at the British Council, the Windrock International Organization, ActionAid, and also Transparency International. So she is a development practitioner with expertise in designing and conducting a qualitative research on various topics. And through this webinar, she will talk about her expertise and the skills that she uses as a Commonwealth alumnus in using research evidence to influence policies and to bring about change in communities in Bangladesh. So, Zinat, over to you to start with your presentation.
Thank you, Eva, for introducing me and giving me the opportunity to facilitate this webinar. I'm very much honored to do this presentation. So, welcome everyone. Good morning and good evening or good afternoon from whichever time zone you're attending to today. Thank you so much for joining. So today, I'm not going to do a very much scholarly presentation or something like that. I'm here today to share my journey as a Commonwealth scholar, and I will share my engagement as a Commonwealth scholar. And throughout this process, I will discuss how I'm utilizing research evidence to change the lives of the poor communities or people I work with. As Eva already introduced me that I work for CARE Bangladesh, but you know, a person can work for various organizations in various countries, but as a person, my most important entity is a Commonwealth scholar. So today, I will talk about my experience and expertise as a research practitioner mostly. So before after coming back from Commonwealth, actually before that, I was working as a communication and knowledge management expert. But after I come back to Bangladesh, I came back with solid research skill and experience that I learned from studying in the UK. That was not possible without the help or support from the Commonwealth. So I am working as the senior team leader for knowledge management, research and learning. So in this role, so now I lead the design of operational research and knowledge management on behalf of my organization. So which this research supports improving or changing the lives of the underprivileged or remote communities who lives in the remote areas, the poor communities. So today I will share the journey and the stories, how I do this. So these are some experience of as Commonwealth scholar. As you can see in the photos, the left photo, it was from the welcome event in London in 2017. So I'm not sure whether you'll be able to recognize me or not. I'm not the lady in the shari, the left photo. I'm just after the lady in the shari, right side of the, I was wearing a formal suit. And the next photo, I'm very proud to share that I was the Commonwealth flag bearer for 2017, and this photo is in the Westminster Abbey. So these were some memorable experiences. So today I will discuss with you the ways and steps of utilizing research and evidence to change lives of the underprivileged poor communities. While doing so, I will focus on the issues, ways, and processes of utilizing research rather than the research methodologies, methods, and techniques and ways of doing research. So I will use two research projects as examples to support my discussions. So I think at this point, I would like to turn off my camera so that I could get uninterrupted internet connection. So here you can see an overview of my presentation. First of all, as the first thing, I will discuss a very important tool, that is the collaborating learning and adapting tool. This tool is proposed by the USA. So US Agency for International Development. My project is a USAID project. So I have learned using this tool working here. Then I will discuss the impact of research collaboration with universities. I will give an overview of the organization and project I work with as a context or background. Then I will give the an overview of the geographical location where I work actually. And then I will discuss how we have included the community members of Chor and Howard. And then I will use two examples, the ways how I have utilized research for policy advocacy and how we have utilized research to collaborate with stakeholders. Eva, I think something is wrong with my slide. I cannot move my slide.
Yes, it is on the webinar overview slide.
Okay. Yeah, it's
Yeah,
okay
and
now.
let's go on to the next slide now.
Oh, as I was talking about the CLF tool of USAID, you can see this tool has two parts. On the right side, we have the enabling condition. On the left, you have the CLE in the program cycle. So the enabling condition is the organizational process, culture, and resources. So for this presentation only, I will not discuss about the enabling condition, but I will discuss about the left side, which is the collaborating, learning, and adapting. So for the collaboration part of a CLA structure or framework, we work for the internal collaboration and external collaboration. And in the learning part, we generate evidence. We generate evidence from the MED findings, scenario planning, theories of change, and technical evidence base like research, studies, assessments, and reports. And adapting and learning. This is the most important part for utilizing research to change people's life. So whenever you do a research, and if you do a research and keep it aside, it will not make any changes to people's life. You may hope that, okay, people will read your research and they will utilize it. But actually things doesn't happen like this. So you have to make people understand what your research contains. You have to clarify people about the findings of your research, and you have to give people the ideation of how to utilize this research. So pause and reflect and adaptive managements are the ways to utilize the research. So this is the basic framework we use for utilizing our research findings. So it was a photograph from a knowledge sharing event with an university. I think now you can recognize me. I'm the person in the rightmost corner in purple sari. This is me. So we collaborate with universities for research and organize joint events with them to share our research and study findings. So now you may ask me why we work or collaborate with the universities. This is because it's a platform for sharing joint wisdom. Working with universities makes us stronger as we attain academic insights and inputs from them. And when we work with universities, it also inspires them to design more research to change the lives of the remote communities we work with. So it's a both-sided issue working with the universities. So now I will talk about the project where now I'm working now. So as I have already shared, I work for CARE Bangladesh, and the donor is United States Agency for International Development, that is USA. And the name of the project is Strengthening Household Ability to Respond to Development Opportunities, Shuhardo 3+. It's a 2-year activity, 2022 2024. And main goal, I'm also narrating the main goal of the project as it is. So delivering improved, gender equitable and resilient food and nutrition security to at least 1,068, 521 vulnerable households of the Char and Haur regions in 8 districts of Bangladesh until 2024. So I have several times mentioned Char and Haur regions. Now I will discuss what that actually mean to the global audiences like you who don't live in Bangladesh. So as you can see in the on the left side, you can see this is the entire map of the Bangladesh, and you can see the two green section. So if I talk about the first green part and I keep it out as a piece of cake, so then this will be the structure. So these are the chor areas: Kurigram, Gaibandha, Jamalpur, and Shirazganj. These are the 4 chor districts we work here. And then this part, this is the Haur, Netrokona, Sunamganj, Kishoreganj, and Hobiganj. These are the 4 more districts. So in total, my project Sohardo 3 plus work in these 8 districts. These are all very remote. Now I will discuss why these chors and haurs are so remote. So actually chor and haur both are far from the mainland of Bangladesh. The chors is not a stable, chors are not stable land. These are the alluvial landmass. They emerge from the rivers, and these chors are prone to erosion and flooding. And the haurs are also seasonally flooded, vast woodland ecosystem in northeastern Bangladesh. So the remote locations and poor infrastructure, like the limited roads and bridges, makes it difficult for the mainland services and facilities to reach the Chor and Haur regions. And again, the flood and seasonal changes can disrupt the transportation and damage existing facilities. So these are the factors that actually collectively contributes to the hard to reach status of the Chor and Haur regions. And again, so due to this complex geographic condition, there are two common occupation in Chor and Haur. These are the agriculture and fishing. So the people are living in poverty and economic hardship in the Chor and Haur regions. So the next slide is on how the geographic feature can affect the health system in Chor and Haur regions. As you can see, there is a river and there are boats and the horse cart. This is a Chor, it's a remote Chor region of Bangladesh. So there the only transportations are boat and the horse cart. So you can see the horse carts are carrying people and their belongings. So these geographical features of Chor and Haurs are compounded by poverty, limited health infrastructure and facilities. And there are a very limited health infrastructure, and even our study funding shows that there is a lack of qualified healthcare professionals in the Chor regions, especially the maternity healthcare services. People are suffering a lot for their maternity healthcare services in the Chor and Haur regions. So now I will talk about some Sohardo 3+ interventions. So to support the community of Chor and Haur regions by increasing their capacity and income and enhancing their linkage, the Sohardo 3+ has developed a pool of local entrepreneurs or service providers. Actually, these local entrepreneurs are the locally led solutions for the community. They provided different services to their community, and they're all the community people. So the Sohardo 3+ has developed. Sohardo 3+ actually it's a program. It's the 17 years of this program. So in the predecessor project Sohardo 3, this project has developed 2,300. It's a cadre of 2,300 local service providers, and they are providing different services, different types of services to the community, like the agricultural services, savings ledgers, and health LSP. So we have 3 different types of LSPs who provides 3 different services. So the health LSP, they're called the private community skill birth attendants, or PCSBS. These PCSBS were introduced in 2021. So actually, who these PCSBS are? These PCSBS are women entrepreneurs. They're selected from within the communities and serve as the local service providers. They are trained, they received a 6-month training from the Bangladesh Nursing Council as the skilled birth attendant. So this project has already trained 143 women as the PCSBS, but some dropped out, and currently we have only 128 PCSBS. They're working in the Chor and How regions. So next slide is on the nature of the service provided by the PCSBS. The PCSBS provide a wide range of maternal and child healthcare services, such as the antenatal services, postnatal services, support for normal deliveries, essential newborn care, ensuring that pregnant and new mothers receive holistic assistance from prenatal examinations to post-delivery care. They also offer range of services such as pregnancy identification, registration, family planning, growth monitoring for the children under 5, and community-based childhood illness management. So actually, these PCSBs are providing a quite wider range of services. These are much needed services to the community. But the problem is, despite their significant contribution in improving maternal health in Chor and How regions of Bangladesh, they're not officially recognized by the Ministry of Health of Bangladesh. This is a very sad thing that they are not recognized, but committee loves them, committee trusts them. They have already attained the trust of the committee, and they are religiously providing their services. But a major reason behind this is that the government of Bangladesh is promoting institutional delivery. However, it is seen that the capacity of the government in the remote Chor and How area in providing the healthcare facilities is very limited. So the Chor and How dwellers mostly relies on traditional birth attendance due to remoteness, poverty, and socio-cultural barriers and beliefs, and so they remain out of the coverage of these institutional deliveries. So this is our problem statement. So at this point, Shohardo 3 from the Shohardo 3+ as the research lead of Shohardo 3+. So I initiated a research project in the end of 2023 to assess the roles of PCSBS in formal and informal maternity healthcare services. This research actually aims to identify the scope of formal inclusion and recognition of PCSBS in the health infrastructure of Bangladesh. And institutional mapping conducted under these studies revealed that government's formal health infrastructure in these regions lack sufficient facilities and staff for antenatal care, postnatal care, assisted delivery, and other maternity healthcare services. The research finding also shows that the PCSBS can help Government of Bangladesh to execute its plan to increase the number of safe institutional births by guaranteeing that all mothers receives ANC, AD, and PNC. And one interesting thing is that this research has two parts. The research is designed by me and my team. Then we have hired one national consultant for data collection and analysis. Then I collaborated with my beloved University of Reading for finalizing the report, for publishing the articles for academic journals, and wider dissemination at different levels. So this is how, as a Commonwealth scholar, I always wanted to go back to my UK institutions, and I always wanted to go back in UK and UK environment and culture. So once the project is done, research project is done, finalized, so we'll have some knowledge sharing and dissemination events at different levels. So it will be at different levels of Ministry of Health and Family Welfare and Department of Health in Bangladesh. And then we'll have knowledge sharing events with 2 universities in UK, jointly with the University of Reading. And we'll also ensure wider dissemination of the findings of the study to improve service delivery in Bangladesh's maternity healthcare system. Even on this day, today, we had a team meeting and we were discussing about the study findings and how to convince the government, how to advocate with the government with such a complex issue when the government is focusing on the institutional delivery. But I am very confident because I have the research evidence. I'm not scared, actually. I have the research evidence. I have the complete institutional mapping about the government's health infrastructure. I know the gaps. So I'm confident to share it as a policy brief with the government. So this is the way we are going to utilize the research. So now I am going to I'm going to take a pause of 30 seconds. Am I audible, Eva? Eva or anyone? Am I audible?
Yes. Sorry for the
Okay.
delay.
Thank you so much.
My
Thank
mouse
you
got
so
stuck, but yes, you are audible. Uh,
much. Okay.
everything is working
Yeah,
fine.
thank you. I took a pause because I think we needed a pause at this point
Okay.
because I will talk about another example.
Yeah.
So, as I was already talking with you that I have completed my study in environment and development, and I also had some courses on climate change, and I also had some courses on agriculture. So, while I came back to Bangladesh and I'm working here as the research lead, so I always trying to do something. I always try to do some work on my academic experiences or academic learning. And we have a very strong component of agriculture in this project because this project work for improving people's nutrition and food security. And you know, agriculture is closely related to food security. So I was trying to see what agriculture interventions was undertaken by the project in past 17 years. So I have found that the Short 3 Plus and its predecessor projects already train the participants by showcasing diverse and improve agriculture techniques so that they could improve their livelihood by adopting those practices and they could ensure food security for their family. So at this stage, I plan to assess how effective those practices were in improving their livelihood through transformative changes. So initially, we did a secondary literature review. I and my team did a secondary literature review on improved agricultural practices. And however, to elucidate the transformative changes, we also conducted a rapid qualitative survey. And at this point, I was also thinking to utilize these research findings. So let me discuss about the study objective first. So the primary objective was that Shordo 3 Plus has developed different improved agriculture practices and shared with the community. So the study objective was to see what was the most adopted agriculture practices in the Chor and How regions that was promoted by the Shohardo. Then the study also described how these techniques brought transformative changes in the livelihoods of the poor and extreme poor population. And the third objective was way forward to sketch a dissemination roadmap that involves care, academia, and government stakeholders to reach the end users, that is the last mile farmers. So from our study findings, we have seen that these 5 were the most used or most adopted improved agricultural practices. 71% of our participants are using adaptive rice varieties. I have already shared with you that the Chor and How has extreme condition. So the rice must be saline, must be water and saline tolerant. So these are the water tolerant and saline tolerant rice varieties. Then the comprehensive homestead production, as it's a nutrition and food security program, comprehensive homestead production is very important for a project like this. Then the cattle farming or loft goat rearing. This is also another popular practice used by 58% of our population. Then the hatching basket for the chickens is 46%, and hand pollination, it is 38%. So the important findings from the study, most interesting things that when we interviewed our participants, we found that they, by climate change, they only understand that it's frequent flooding. So our idea was to educate farmers on the broader implications of climate change beyond their current understanding that climate change primarily causes frequent flooding. They don't know other consequences like droughts. It can be also the effect of climate change and salinity. So they only understand frequent flooding and dissemination of good agricultural practices. Interestingly, the Department of Agriculture Extension of the Government of Bangladesh also has the same objective. They also want to disseminate the good agricultural practices to the remote communities. So they know that, okay, we have disseminated all of their practices, but they are not aware that the last mile farmers that we reach from our project, are not aware of these good agricultural practices. So we have explored the alternative methods for disseminating information effectively, considering geographical and logistical constraints of Chor and How. So they didn't consider the remoteness of Chor and How, the Department of Agriculture Extension of Bangladesh. So way forward, this is our study findings. So way forward is that collaborate with the relevant departments and ministry and non-governmental organization for widespread engagement and support and developing a comprehensive roadmap. So we are emphasizing more on a comprehensive roadmap, educating next generation agriculturalists. So it's a core thing that came out of our study, that equip graduate students with knowledge of the latest advancement in agriculture. As you can see in the photo in left hand side, it's a demonstration actually, it's the field demonstration. It's not the original homestead. It's made by the natural equipments from the students of an agriculture university. We supported them to set this installation, and one of the students, they shared with me we were distributing prize for this demonstration, that this is the first time in my graduation life I have enjoyed demonstrating the practices that I have learned. So actually the seeing is believing. This is how people, this is also applicable for the farmers. They believe what they see. They don't believe what they don't see. This is the idea, the demonstration. That is why the way forward is to educating next generation agriculturalists. And then research and development. So intensify the research initiatives, focusing on the unique environmental aspects of Chor and How regions. I will discuss more in my next slides. So finally, with the study findings, we organized a knowledge sharing event with Bangabandhu Sheikh Mujibur Rahman Agricultural University. This is a famous agricultural university in Bangladesh. As you can see, these are all professors, except me in the left side, green shari. So all are the professors of the agriculture university. So we shared our study findings with them, and we found that they also know the technology, but they don't care about the dissemination mostly they don't care up to the last mile farmers. So this is how we collaborated with them here through this knowledge sharing and dissemination event. So what happened actually in this knowledge sharing event with our study findings? This event brought the academia, Care Bangladesh, and the officials from the Department of Agriculture Extension, who are actually the frontline workers, to disseminate these good agricultural practices. And this event also brought the next generation agriculturalists, like the students that I already discussed. And this panel discussion from this knowledge sharing event revealed a gap in disseminating the improved practices, and it sketched a future roadmap that I already discussed, that it was a way forward that came out from our study, that we need to develop an effective roadmap for wider dissemination of the good agricultural practices, or GAP. These study findings can be used to educate farmers on the broader implications of climate change, going beyond their current perception that climate change primarily causes frequent flooding. This is needed for their readiness, because they don't know about the drought and other consequences of climate change. If they know the consequences, all other consequences of climate change, only then they will adapt the climate resilient agricultural practices. And furthermore, these types of study can help in shaping future advocacy efforts to efficiently disseminate improved agriculture techniques, considering the geographical and logistical constraints. And this collaboration, we believe that we just recently finished this knowledge sharing event, and we believe that it will initiate future research and development initiatives in this regards. So I think I'm done with my presentation. And in my short presentation, I have tried to share with you my experiences of how we use research evidence to change life of the poor communities who are living in the remote areas. Thank you. Over to you, Eva.
I knew I was on mute. Thank you so much, Zinat. I'm sure the attendees would also echo my thoughts in saying it was a brilliant presentation on the projects that you have been involved in and how you have used that data and how confident you are that the data is going to be disseminated for development impact and for change. As we now move forward to the Q&A session, I'd like to invite attendees to please send in your questions in the chat box. And I will do my best to raise these questions with our speaker, Zinat. We have also received questions in our registration forms. So thank you to everyone who have sent in your questions in advance. I think I'm going to start with some of those questions and then I will wait for questions to come in the chat box. So, Zinat, if you are ready, can we start with the first question?
Yeah, sure, please.
Great. So the first question is the person who has asked the question is particularly interested in knowing how you translate research for intervention development and approaches used to measure impact or outcome as a result of the work that you do.
Okay, thank you. So we don't know who sent this question, but it's a very nice question. Thank you so much. So how we translate research for intervention. As I have already shared with you two examples, you have seen that from the second study on agriculture, improved agriculture practices, we had an interesting findings that we need to sketch a roadmap for wider dissemination. And finally, when we talk or collaborated with all of the stakeholders like the Department of Agricultural Extension and academia, finally we agreed to collaborate on sketching a roadmap. So this is how we translated research for intervention development. This is an intervention and approaches to use the measure impact or outcome. Actually, there are several ways to measure the impact or outcome. Sometimes it is through mini assessment, sometimes it is through research. So when you do KII or IDI, then you can measure, you directly talk to your people or your participant. They will share their experiences, they will share their journey. So this is how when you translate these two research narratives, you can measure the impact or outcomes. Thank you.
Great, thank you so much. The next question is sustainability is a concern, especially in remote regions. What strategies are implemented to ensure that positive changes are maintained over a long time?
Okay, so here I will share my experiences as a development professional because sustainability cannot be maintained over time through donor-funded projects because the projects are not forever. The projects will end at some point. I can give example from my project Shohardo. As I have already discussed with you that we have already established a set of a cadre of 2,300 local service providers, and they are the locally led solutions to the community. So we are building their capacity. We are providing them with the resource. We are supporting them to establish linkage. So once the project will phase out, the resource capacity and linkage will stay there, and the community will stay there, and the local service providers and their government will stay there. So these all together actually contributes for the sustainability interventions. Thank you.
Great. Thank you so much, Zinat. The next question is from the chat box. And the question is from another fellow alumnus from Bangladesh. So Hasib is asking any major challenges that you have faced or perceived in terms of communicating evidence with government officials in your experience?
uh, I have not yet faced any such challenges because when your evidence is well tailored and you are confident about your findings, then actually it never happens. We also have another work with the Financial Inclusion Department of the Bangladesh Bank. Sorry, I'm sneezing from this morning. So Financial Inclusion Department of Bangladesh Bank. So before going to reach out to the Bangladesh Bank Financial Inclusion Department, we did an in-depth study on the status of the financial inclusion in the remote Chor and How regions of Bangladesh. And before going to reaching out to the government, we did an in-house pause and reflect meeting, and we discussed about our study findings and pros and cons. And before going to government, we developed a policy brief and research brief that is very well tailored. And then we actually never faced any challenges on hurdles from the government side because of the strong evidence base. Thank you.
Do you want to take a break to sip on water, or are we happy to go with the next question?
No, thank you. I'm fine.
Okay. Um, Great. The next question is, based on your research, how did you select the entrepreneurs? So this is for the PCEB essays project. Based on your research, how did you select entrepreneurs to consider for training from the broader population or from the local communities? What was the success rate to achieve the 2,300? I'm not sure what the 2,300 reference is, but what was the success rate?
Actually, the entrepreneurs or the local service providers are not selected based on the research. Rather, we are doing the research to support them. So the most important selection criteria for these entrepreneurs are their level of motivation. And we have a system of village grading. The most advanced village, we have mid-category village and the lower category village, considering the people's income, their level of awareness, and their level of engagement. So we support the lowest grade and the mid grade. We don't support the higher grade, and we also consider their poverty, the nature of their poverty, and this is their selection criteria. So my research is not meant to this, because these local service providers are working for this project even before I joined.
Yep.
So I am working to bring them in the forefront, and I'm working to ensure better advocacy and linkage for them. Thank you.
Great. Thank you so much for clarifying that information. Um, do you have any recommended frameworks that one can use for knowledge transformation, for knowledge translation or dissemination of research evidence?
I think the framework I already discussed, CLA framework, you can find it in the Learning Lab of USAID. So CLA framework, and you can find thousands of documents on CLA. This is the best framework I have ever used for utilizing research evidence. Thank you.
All right. Coming back to questions that we received in advance, there's one for policy. How can policymakers be persuaded to transform their attitude towards addressing the issues of individuals living in remote areas?
Okay, thank you so much. So it's an interesting question. So I'll have to go back to stories again. We have, I think I have already shared with you 3 types of local service providers. We have saving agents, that is the village savings. We call them the village savings and loan association. These are the savings group led by women. So these women previously never had any bank accounts, they never had any bank accounts, they never had any savings. So we improved their savings practices. We encourage them for we encourage them for group-based savings. So gradually, we found that this sort of savings is supporting their empowerment and improving the living condition of their family. So since 2020, we have started advocating with the Financial Inclusion Department of Bangladesh Bank for the formal recognition of this community-led savings and loan group. And to persuade with government for this advocacy, we did a financial inclusion policy analysis. The first study, it was done by us. And then we presented the findings before the government. And then as a next stage, and then the bank people, the financial inclusion department people, they visited the field, they talked to the beneficiaries, they talked to the VSLA group, and they actually assess the facts and figures there, and they are convinced. And finally, then we designed another study that reveals the loan infrastructure, loan infrastructure, that how people are trapped in the loan cycle by the private money lenders and the microfinance institutions. Then we also again presented another policy paper that we need to get people from this trap of the private money lenders who are were imposing very high interest rate. And we also advocated for financial literacy of them. And finally, we received a circular from this. This is the way we actually persuade the government. And Bangladesh Bank and circulated an advice for all of the commercial banks to open bank accounts only with 10 taka for these groups, for these women who never had any bank account of their own. So at part the government circulation now, most of them have, we in just in 3 months, we have opened about 4,000 10 taka bank accounts, and these women are now getting loans from the private commercial banks in a very simple interest rate. It's less than 5%, which was in fact above 24% previously when they took it from the Mali lenders. So these are our advocacy pursuit, and which is also from the evidence base. Thank you.
Thank you so much. Quite a few questions coming in. So there's another one for policy, and the question is, what can accelerate the inclusion of such research findings in government policies? Um, is disseminating findings only enough, or are there other steps required to call for attention of the policymakers?
Yeah, dissemination of research findings, and also some important things like recently after the Russia-Ukraine war, we have seen a major price hike. So once and in this price hike situation, our in the eminent team of my project did the quantitative assessment of the price hike situation. Then what my team did, as I also lead the communications, my team went to field and they collected first-hand story from the community. And from this story, we found that people are skipping their meals. Sometimes they're sacrificing their medication. Sometimes they're sacrificing their housing. So they're sacrificing so many things. So these are first-hand human interest stories. Then we also share these stories with the global donors and the community, and we had the call to action to support them. So not only the findings of the research dissemination, but also the first-hand human interest stories and the social media campaigns. These sort of tools are very important for the policy gain. Thank you.
The next question is a very interesting one. There are two parts of the question. I think one you have already touched throughout the webinar. How has your experience been as a women researcher? And of course, the next question is, have you noticed any positive changes in the lives and living conditions as an impact of your research? So, very quickly, would you like to summarize and talk about your experience as a female researcher?
Uh, I think I'm not interested to uh, keep any gender tag to this. As a female researcher, I'm a researcher, so I don't face any such challenges as a researcher as all. I would honestly say, uh, but some types of challenges when you talk with the issues like the intimate issues like the childbirth and the marital issues, the antenatal care, postnatal care, the major challenge is about managing your research ethics, because sometimes your respondent might feel uncomfortable to answer your questions, but you don't have the way to force her or ask her again, and she might say that, okay, keep it anonymous. To managing the research ethics is something a critical challenge, I would say. And how it has changed life, I think I have given thousands of examples already. Like the most important example is the how the rural women who never had any savings at all, now most of them had their own bank account, and they're saying that I will utilize this loan, and now I am in charge of improve the living condition of my family. So these are the real changes that happen actually. I'm so proud of these changes. Thank you.
Great, thank you so much. All right, maybe okay. The next question is, what approach do you use to ensure that the most marginalized among the already marginalized are included in your research? For example, people with disabilities in the remote communities. How do you ensure that vulnerable groups are also included, or marginalized groups are also included in your research?
Okay, actually, different development project has different emphasis. We don't directly work for the person with disabilities, but we work for the poor and extreme poor people. So if someone is the poor and extreme poor, and above all, he or she is disabled, definitely we will include this in our as our research participant. So this is how we prioritize them. Thank you.
All right, going back to the list of questions again. How can academia and development sector collaborate more to promote research and evidence-based actions for socioeconomic development?
I think my second research project with the agriculture university is a good example of this one, because you know the government, like the Department of Agriculture Extension or Department of Livestock, they're forever. The departments of the government authorities, they have the power to change people's life. Academia has the academic insights, and this is the development professionals or the development community who are to link these two groups to use their power, and one section to use their knowledge and insights. So the development organization can use as a bridge between these two. That I have already shared in my research example. Thank you.
Great. All right. So I think with this we will end the Q&A session. Unless we have attendees who'd like to ask more questions, please do send in the chat box. But if you can just share the there is one more. There is one question that has just come in. Have you developed a mechanism within the CLA tool for it to be adopted within the poor communities by way of learning from their challenges and adopting to solutions found by themselves?
Uh, we have not yet. Honestly, we have not yet, but we are always open to hear their voices. This is our way of adaptive management and reflection. We frequently go to reach out to our participant. We listen to their story and we highlight our stories. So this also falls under the CLA. So their storytelling or their case stories or their experience sharings, and we also give much more importance to the direct course or experience of the beneficiaries. So this also falls under the CLA tool of learning and adapting. So yes, we have adapted. And if you ask me formally, then I will say, no, we have not. Thank you.
But it's a work in progress from what I hear.
Work in progress.
Yes. Great. Thank you so much for responding to all the questions that we have received. I would now request you to share your PPT slide again so I can share um, your contact details with all attendees. Yep, the next slide. Yes, thank you. So once again, thank you so much for sending in all your questions in advance of the webinar as well as during the webinar in the chat box. If you would like to connect with Zinat, you have her email address on your screen. Please do feel free to get in touch with Zinat to connect with her if you'd like to collaborate with her or just learn more about her work in Bangladesh and also learn more about the projects that she has spoken about today. With this, I would like to formally end this webinar. Thank you so much, Zinat, for sharing your work and expertise with us. It wasn't just about research and how to do research and research methodology skills, but you went above and beyond of sharing information on how we can use the outcome of research findings in bringing about change in our local communities or at a national level, even with influencing policies. So thank you so much for your brilliant webinar presentation. And I would also like to thank all our attendees for joining the live webinar. Would you like to summarize very quickly before we move ahead with the next segment of this webinar?
Okay, sure. The summary of the overall presentation?
Yeah, would you just like to summarize your
Okay,
experience as
okay.
a speaker and
So
the
in
webinar
my
topic?
presentation today, I was discussing about two of my ongoing research project as the research lead of the Shuhadu 3 Plus of Care Bangladesh. So I was trying to explain how collaborating with the internal and external stakeholders and generating research evidence and adapting and learning can change the lives of the remote communities, the poor communities who lives in the remote areas of Bangladesh. And I was also discussing how to disseminate and utilize our research findings with the government and other stakeholders to change policy or make any major changes that will help to improve the lives of the poor communities. Thank you. I think this is the two-line
Yes,
summary.
yes, it's a brilliant summary of the presentation. If I can again request you to get the PPT slides so I can explain what the next segment is.
Sure.